Hey, that is strange that you would ask me that. When I'm not a Buffalo soldier, I am a physician's assistant, and I am down in Baton Rouge right now at Our Lady of the Lake Hospital. And one of our initiatives, before we discharge, is to make sure that patients are leaving with a controllable A1C. And we are like one of the few hospitals in the nation that are in the top percentile of that, because we feel that as a community service, A1C and control of it, especially in the Black community, is something that's been well overlooked. Had a really, really good friend of mine died of lupus, and lupus is a controllable disease, if it's caught early on, and measures are taken. However, as African Americans, we tend to ignore those symptoms and ignore those things. And then not only from us, it is undiagnosed, from our community, So if you know the questions to ask, so if you're having chronic fatigue, if you're having those issues, when you want to ask your physician to rule out, hey, could you rule that out? And therefore, it will be looked at, so always, hey, so I'm an African American. These are the things that happen to my people. Is lupus something that we're looking at? Because a lot of times they don't even look at that. So you got to kind of know your heritage, know what belongs to you. So rule it out. It doesn't surprise me. I think it's underdiagnosed in our community. I think it's underdiagnosed. I think that other communities have it, and but their access to healthcare is more than our access. So if you looked at the ratios, I don't think it'll be that much different. But when you look at early onset, what really the study needs to be done is when the lupus was caught. In African Americans community, I think it's called like third, fourth stage. In other communities, it's called first, second stage. So that's what is easier to manage. My name is Mark A. Smith, and I am now included.